Fiasp, insulin aspart injection 100 units per milliliter. Fiasp is a rapid-acting insulin analog indicated to improve glycemic control in adults with diabetes mellitus. Fiasp is contraindicated during episodes of hypoglycemia and in patients hypersensitive to Fiasp or one of its excipients. Please listen for additional important safety information in this video. Please click below for prescribing information.
Fiasp is insulin aspart with 2 additional excipients, niacinamide, a vitamin B3 amide, and an amino acid L-arginine. The addition of niacinamide increases the proportion of insulin aspart molecules in the monomeric state once injected, which increases the rate of initial insulin absorption. The addition of L-arginine aids in stabilizing the formulation. With a fast initial absorption into the bloodstream, the onset of appearance of Fiasp is approximately 2.5 minutes. There are 2 dosing options for Fiasp. It can be administered at mealtime, but patients can also inject up to 20 minutes after the start of a meal.
Changes in insulin strength, manufacturer, type, or method of administration may affect glycemic control and predispose to hypoglycemia or hyperglycemia. These changes should be made cautiously under close medical supervision, and the frequency of blood glucose monitoring should be increased.
The ONSET-1 clinical trial compared A1C reductions in adult patients with type 1 diabetes using mealtime or post-meal Fiasp or mealtime Novolog. After 26 weeks, non-inferiority of mealtime and post-meal Fiasp compared to Novolog with regard to change in A1C from baseline was confirmed. In patients with type 1 diabetes, Fiasp also demonstrated A1C reductions versus Novolog when dosed at mealtime. The ONSET-2 clinical trial compared A1C reductions in adult patients with type 2 diabetes receiving either Fiasp or Novolog in combination with basal insulin. After 26 weeks, the study confirmed non-inferiority of Fiasp to Novolog when used in combination with insulin glargine and metformin with regard to A1C reduction from baseline. The ONSET-3 clinical trial compared A1C reductions in adult patients with type 2 diabetes who either added Fiasp to their current basal insulin regimen or remained on basal insulin alone. After 18 weeks of treatment, the study concluded that the addition of Fiasp to basal insulin and metformin provided superior reduction in A1C compared to continuing basal insulin and metformin therapy without the addition of Fiasp. When considering Fiasp for your adult patients with diabetes, remember these fast facts. 2 excipients were added to insulin aspart: niacinamide, which increases the speed of initial insulin absorption, and L-arginine, which aids in stabilizing the formulation. Fiasp has an onset of appearance of approximately 2.5 minutes. There are 2 dosing options for Fiasp, either at the start of a meal or 20 minutes after starting a meal. And finally, Fiasp has proven efficacy in 2 patient types: adults with type 1 and type 2 diabetes.
Warnings and precautions. Never share a Fiasp FlexTouch pen between patients, even if the needle is changed. Patients using Fiasp vials must never share needles or syringes with another person. Sharing poses a risk for transmission of bloodborne pathogens. Hypoglycemia is the most common adverse reaction of insulin, including Fiasp, and may be life-threatening. Increase glucose monitoring with changes to insulin dosage, co-administered glucose-lowering medications, meal pattern, physical activity, and in patients with renal impairment or hepatic impairment or hypoglycemia unawareness. To avoid medication errors and accidental mix-ups between Fiasp and other insulin products, instruct patients to always check the insulin label before injection. As with all insulins, Fiasp use can lead to life-threatening hypokalemia, which then may cause respiratory paralysis, ventricular arrhythmia, and death. Monitor potassium levels in patients at risk for hypokalemia and treat if indicated. Severe life-threatening generalized allergy, including anaphylaxis, may occur with insulin products, including Fiasp. Fluid retention and heart failure can occur with concomitant use of thiazolidine diones, TZDs, which are PPAR gamma agonists, and insulin, including Fiasp. Patients should be observed for signs and symptoms of heart failure. If heart failure occurs, dosage reduction or discontinuation of the TZD must be considered. Adverse reactions. Adverse reactions observed with Fiasp include hypoglycemia, allergic reactions, hypersensitivity, injection site reactions, lipodystrophy, and weight gain. The safety and effectiveness of Fiasp in pediatric patients have not been established. Like all insulins, Fiasp requirements may be reduced in patients with renal impairment or hepatic impairment. These patients may require more frequent blood glucose monitoring and dose adjustments. Please click below for prescribing information.